It's Kimberly here, registered nurse and business development director with Specialty Care Management. Thanks to so many of you who have liked and followed Specialty Care Management on LinkedIn, as this month we've been featuring our kidney bites, the 5 major risk factors that lead to kidney disease, and some simple things that you can do to mitigate that risk. You know, as a former emergency room nurse, triaging was an important way to manage the needs of the patients who would come into the ER. Triaging looks like, if you remember basic first aid, airway, breathing, circulation. It's a matter to prioritize actions to help improve outcomes and mitigate risk or mitigate cost. Savvy brokers, advisors, consultants employ triaging as well for the employer groups that they serve. It might look something like, as you look under the hood of your groups and you analyze those claims that come in, you might be able to identify some areas that really need help and difficult to tackle everything all at once. So most of the time, you're going to divide those up into what's hurting your group the most right then and address that in a step-by-step fashion, working forward then or backwards, upstream, if you will, to mitigate risk now and in the future. Usually what I find is this is going to start with pharmacy first, and then we're going to look at cancer, then we're going to look at dialysis, then we're going to look at diabetes and so forth, so that eventually over time, we have in a step-by-step and appropriate fashion help to reduce cost and improve outcomes for the entire population. At Specialty Care Management, we support brokers in this step-by-step fashion by offering appropriate risk mitigation programs that not only improve outcomes, enhance the benefits as they currently stand, but also to reduce spend and preserve capital, which I think will be even more important as the state of the economy progresses. So what that might look like for your groups is finding where that bleed is occurring. Where is the most harm being done for the group? Where's the greatest loss, the greatest risk? Usually that's going to be in cancer or dialysis. In terms of dialysis, that triaging perspective might look like putting into place our flat fixed case rate for any active dialysis cases. Upstream from that would be preemptively putting that in place, meaning that for folks who have a risk of dialysis, that we contract to ensure that when those members go to dialysis, they have that $1 first day access to our proprietary and unique flat fixed case rates to mitigate that cost. On average, we're saving our clients 77.5% off of dialysis without the noise or kickback that frequently accompanies other kinds of cost savings measures. Upstream from that would be our CKD management program. This is a program that looks for those folks who have kidney disease and how can we help slow that down, control that, or halt the progression so that hopefully these folks never end up on dialysis or that they have a controlled start. By avoiding an emergent start to dialysis, you save over $150,000 just in one member alone. A chronic kidney disease management program can literally save your groups millions of dollars in helping to avoid future dialysis costs. Our cancer management program is very similar in that for the flat fixed case rate, members have access to a nurse coach to help them have the best outcome at the lowest cost. This program can also be applied to the entire population, looking for folks who are at risk of cancer. The really sad statistic that we're seeing right now is a dramatic uptick in initial diagnoses of very late stage cancers. We're seeing folks who are quickly becoming the biggest spend for the group that have poor outcomes for what are considered to be largely preventable cancers. This is where a cancer management program can really be a robust measure to mitigate one of the highest and most catastrophic claims types in the industry. Upstream from kidney disease or cancer would be population health. Our Health Rates 360 program covers the entire population in an appropriate manner, where nurse coaching is preserved for the highest or the emerging risk. That's going to be about 6 to 10% of your population who likely have under $10,000 in spending. And on initial glance at those claims, they might not appear to be high risk, but we know based on what we see in claims that they are fixing to become your biggest spend. By avoiding that big spend, there's a whole lot of savings in there. The average ROI of this program is somewhere in the neighborhood of 5 to 7 to 1. If you'd like to know more about how specialty care management can help you in triaging the needs of your groups to provide more robust savings, better quality care, greater benefit at a lower cost, it's one of our favorite things to talk about. In the meantime, live well, stay healthy. Bye, friends.